Hello, my name is Dr. Aaron LeBauer with LeBauer Physical Therapy here in Greensboro, North Carolina. Today, what I want to do is show you some hip stability exercises, and these are very important for people that run, anyone who considers themselves a runner, so that you increase your hip stability, which decreases your chance of getting injured, especially when you increase your mileage or increase your pace or just run a whole bunch. The first thing we're going to do is 2 quick tests, self-assessments, to see if there is some significant hip instability. The first thing you're going to do is put your feet hip width apart and squat down. And then squat down again and look at your knees and see what happens. If your knees track over your second toe, that's great. If you squat down and you notice your knees come into the center, that means you have some hip instability issue. So from the side, what you're looking for is, can you squat down and keep your knees over your shoes? But if you squat down and your knees come forward, then you've got more of a hip instability or hip mobility issue. Or it could be somewhere else in your body as well. If you want to be able to squat down with your hips back, knees over your feet, upper body upright. So if your knees come forward or they come to the middle, there's a hip instability issue. The next one I want you to do is stand on one leg. And if you can stand here for 30 seconds to a minute, great. Bring a slight bend in your standing knee, and then squat down. And then try that again, but look down and see what happens to your knee. Can you squat down and keep your knee in line with your second toe? And do this on both sides. So start by standing here, and then squat. What happens is, people with a hip instability issue, their knee will kind of dip in. So if you look down and you can't keep your foot at 12 o'clock and your knee right over your toe, you've got a lateral hip instability problem. And with every step when you run, or at the end of your run as you get fatigued, your knee's dropping in. And this can lead to a lot of problems: snapping hip, IT band issues, ankle foot, plantar fasciitis, things like that. So one of the ways to start to correct that problem, or just to make sure that your hips are stable for your running, is to start with some single leg balancing. Start by standing upright, bend your knee to 90 degrees, and stand up tall with your standing foot at 12 o'clock. Find a fixed point on the wall or floor in front of you and stand here for 30 seconds to a minute. You can also bring your hands behind your head, which helps keep your posture upright. And then switch. Then the next one would be to bring your knee and hip to 90 degrees, 90 degrees, 90, and do the same thing. And then you switch. You do each of these for 30 to 90 seconds, twice. Then the way to progress that would be to start to work your arms as you do like a little step back, kind of like you're running. And then the other leg would be like this. When you can do 10 of those stable, then work on marching across the room. And then to progress from there, you march opposite arms. And this is really slow and controlled. And the final exercise, standing on one leg. We're going to move the other leg, but it's challenging the standing leg. Bring a slight bend to your knee, and you take your other leg out. You pause at the top, and come back in. You can do your hands up here to keep your body upright. And for this, do 3 sets of 10. And I'm lifting my foot off the ground. You can also do this on a step or a stool. Slight bend in my standing knee. And this isn't really about this hip, it's the standing hip. All right, that's it. Try these 3 days a week as a skill workout. 2 to 3 sets of 30 to 90 seconds for the balancing. 2 to 3 sets of 10 for the anything with repetitions. If you're marching across the floor, do it for a minute each. Start in bare feet until you're not wobbling, and then put on your running shoes and go through the progression again. Thank you very much. This is Dr. Aaron LeBauer with LeBauer Physical Therapy in Greensboro, North Carolina. If you have any questions, don't hesitate to comment at the bottom below the video, or contact me personally. And if you're not in Greensboro and you're having pain or any issues running, contact your local physical therapist. If you are here in town, feel free to contact me. There may be something else going on besides what's just some quick instability issues. I'd be happy to help you out. Thank you so much and have a great day.